In a strategy to get a funding boost, an Alzheimer's Australia study has found the rate of dementia in Australia to be approaching epidemic proportions. The projected growth in the number of sufferers has been broken down to individual federal electorates. As baby boomers enter old age, we're said to be facing a 50% increase in dementia cases in the next 10 years. This week, protesters marched on Parliament House in Canberra with demands that what's called the Dementia Initiative, removed in the last federal budget, be reinstated in the next. Former Deputy Premier John Watkins is CEO of Alzheimer's Australia New South Wales. I spoke to him a short time ago. John Watkins, welcome. Are you beating this up to scare the federal government into allocating more funds to the Dementia Initiative?
Quentin, it's important that we speak to our parliamentarians in language that they understand and respond to. So by telling them how many people live in their electorates today with dementia and how that will explode over the next 20 to 30 years is absolutely appropriate and legitimate.
Is it working? Mr Swan's got to get the country back to surplus, he says, by 2013. He's got no more money.
It is working in that we've had very sympathetic hearings from ministers, backbenchers. I think everyone in federal parliament recognises what the dementia epidemic will mean. And yes, it is a major impact on the Treasury and will be over the next 20 to 30 years. The Treasury understands that and so too does the Treasurer. But it's our job to argue as hard as we can to get sufficient funds as early as possible.
Aged care is now a federal government responsibility. The states aren't directly involved in the funding of it. Do the state and federal health departments support Alzheimer's Australia's findings?
Absolutely. No one argues with the figures. The movement of responsibility to the federal government is appropriate because it's the only government with deep enough pockets to fund the dementia initiative that will be needed over the next 30 to 40 years in Australia.
Are we talking about a major growth of nursing home care? What trend do you want this to go if we have to have a huge service industry to cover dementia?
There's a huge growth in the numbers. 270,000 Australians today diagnosed, expected to push out to almost 600,000 within 20 years. Most of those people will want to stay at home as long as they possibly can, which is appropriate. Some may also need some attention in nursing homes, residential care towards the end of their journey, and that's appropriate as well.
You're plugged into the global research. The whole of the pharmaceutical industry in this country and the United States is trying to get the magic cure, the pharmacology which will diminish or cure dementia. Have we realistically got any hope of that?
Look, we pray for it, Quentin. I heard a very experienced researcher said it will get it within 5 years, but then he said, I said that 20 years ago. There are many paths being explored. To this point, we don't have the answer. We don't know what causes it other than a build-up of different proteins in the brain, but as to why that will apply to a particular individual, we don't know, and how to arrest it, prevent its development, we don't actually know that either.
We're talking loss of memory, intellect, rationality, social skills and physical functioning. Alzheimer's disease is the most common form of dementia, more common after 65. You've got a whole website here. What's your practical advice to people about maintaining the plasticity of their brains if that is possible?
Look, the researchers do say that you may be able to prevent or delay the onset of dementia by leading a brain-healthy lifestyle. That means looking after your health, especially your heart health, your blood pressure, not smoking, not drinking to excess, and remaining physically, mentally and socially active into older age. So join a club, a film appreciation group, travel, talk to people, argue with people about ideas, about politics, whatever. Keep your brain active after retirement, and researchers say you may be able to defer the onset of dementia.
It's said in your literature to be a killer in the sense that it'll shorten your life substantially. Is that true?
It's a fatal disease. It's currently the third biggest killer of Australians after heart disease and stroke, and within 20 years it'll be the #1 killer of all Australians.
The Dementia Initiative is really both research and preventative strategies. What did it do?
what we need in the extra funds that we want from the federal government is, yes, more money into research, yes, money into risk reduction and better education for the general public, but overwhelmingly it's funds into improving the services that people with dementia and their carers will need. Respite care, better community care, people coming into your home to assist you, and better care and training in nursing homes, so we have appropriate staffing that are well trained.
Are you happy to be out of state politics?
Yes, I am. It was a choice I made 3 years ago and it was the right choice, Quentin.
John Watkins, thanks very much.
Thank you.